Thank you so much, Dr. Mary.
Hi, Patrick.
It's always good to have you on the
Good
show.
to see you.
I love this topic because I went to your office and we actually went through that process, and I went from something that was close to dingy to a lot brighter. It's your fault.
So much fun. It's so much fun. It's the most frequently asked for procedure in dentistry today.
Is that right?
As our smile ages, it yellows. And so taking your teeth up 5 or 6 shades in one hour, basically, I mean, you just feel brighter inside and out.
One of the things that I was really surprised about, because before the show I was talking to your husband, and he was talking about those laser, the strips. Some people try to use those strips. Now, he said you would have to use those for like every day for a year to equate to one session of your 1 hour experience. Is that about right?
Well, everybody whitens at a different pace. But if you review the ways you can whiten your teeth, there's everything from over-the-counter strips that you buy, take-home methods, and in-office methods.
Right.
Obviously, the least expensive, most available to the public are the strips, but they are not allowed to have the strength in the formula that we can do in the dental office.
Right. But then you guys have a method, like what you did for me was something that was very quick.
We used a laser on you.
Now, tell me about that. Like when you think about, I never saw any lights,
Yes.
but yet there was a treatment that you went through.
Yes. Laser whitening is the use of a laser beam to activate the molecules in the whitening agent, make them move quicker, and react on the tooth surface faster. There's another very popular, well-marketed method that requires actually a light that sits outside your mouth. That's not a laser. The laser would be the little wand that goes close to the teeth.
Right.
And there's actually some peripheral damage to skins if women use. It's like a, yeah, I mean, I say that. I have heard. I have not seen firsthand. I think it's, but I've heard if a female patient uses any retinol products, which almost all of us do, or males, that is one contraindication. In other words, you shouldn't use an outside light source. So what the laser does is it allows us to get that activation closer to the tooth with big results. I've worked every position in the office. I've been a dental assistant, I've been a hygienist, and now a dentist. And it's made me a better caregiver on every level for my patients. One of the things I think I've learned over the years is where to put my technology money. You can buy the latest and greatest and it sit on a shelf, or you can figure out within your practice what's going to make the patient experience better. My practice offers several cosmetic procedures that are enhancing smiles with whitening, with Invisalign, the invisible braces, with porcelain work. So we see people's lives improve when we give them a beautiful smile. That's rewarding. The latest and greatest tool I have that keeps me excited is probably the Invisalign, invisible braces. It has allowed me to evolve my practice into a philosophy of move it, don't remove it. In other words, where I was before I had that tool, move it where I want it instead of putting something on top of it. Staying involved in dentistry on every level, local, state, and national, makes me a better dentist for my patients. I would hope that my patients would feel that from that phone call, even that initial phone call, all the way through to the end of their experience, that it was the best care they've gotten ever. When a patient, especially a very nervous patient with some dental anxiety, when they send their friends and family to us, then we know we've done a good job. That's the biggest compliment we can receive. Our patients are our life and our livelihood, and we appreciate every single patient that walks in that door. And these are our family, and we treat them that way.